I'm delighted to open the afternoon session of the ACORN Nurse and Midwifery Showcase this year to talk about the AI Nurses Network, which is a new clinical research network on artificial intelligence in nursing. My name is Siobhán and I'm a senior lecturer at King's College London. So today I want to briefly talk about how AI is transforming healthcare and mention some of its limitations and risks as well as discuss some AI initiatives in the NHS and nursing. But I'll spend most of my time talking about the AI Nurses Network. Before I start, I want to give a nod to Florence Nightingale. She's most famous for her work on infection control during the Crimean War, but she had a background in statistics before she became a nurse. And that mathematical background was instrumental in a lot of the pioneering work that she did throughout her life, including her work on infection control. So she's often referred to as the world's first nursing informatician. And no doubt if Florence were here today, she would be the leading light in relation to AI in nursing. So over the last few years, there's been endless stories in the media about how AI is going to transform healthcare and dramatically improve diagnostics, treatments, etc., as well as speed up the administration and running of the NHS. And I hope it can help us do those things or certainly improve them. But there's also been lots of negative stories in the press about AI because it's not a perfect technology. It has limitations and risks just like anything. So we need to take a balanced approach to AI. It's not a silver bullet that's going to solve all our problems in healthcare or nursing. But the government are investing money in rolling out AI across the NHS, which if it works well, I think will be good for staff and more importantly for patients. The UK government are also introducing regulation to help tackle some of the downsides of living in an AI world, such as issues around copyright, privacy, autonomy, transparency, etc. The AI bill has been through one or two drafts in the House of Lords already, so hopefully we'll see that sometime in 2025, which will impact us all. There's also a national strategy on AI, which is very relevant to healthcare as well. So there's lots happening in the AI space in the UK. And NHS England is using that investment from the government in different ways. It's set up a national AI lab, and that's got a number of programs running, including initiatives on AI ethics, AI for medical imaging, AI regulation, etc. And they're using some of the funding to support pilot projects on AI in different parts of the NHS, which is great. A lot of that investment is in areas of medicine, which is understandable. So there hasn't been as much of an emphasis on other professional groups, whether they are clinically focused or not, but hopefully that will change in the future. Saying that, I did find one nursing project on AI that's been funded via the NHS's AI lab, and it's about automating the allocation of nursing students to clinical placement areas, which is a great use of AI because it's a very challenging and time-consuming task for the practice learning facilitators in the NHS and the people in universities to arrange placement areas for all the nursing students that we collectively train every year. So it's a huge administrative task. And I think this project was at Imperial College Healthcare NHS Trust. So I hope it's up and running now and that we see more of this automation of complex administrative tasks being taken over by AI because it'll free up nurses' time to focus on patient care and student and staff development. The AI Lab also gives out funding via their AI and Health and Care Awards every year. Out of the 80 plus projects they funded so far, I could only find 2 which mention nurses specifically, but hopefully nurses are involved in some of the other AI projects as well. So the first one is called WooBot, which is a suite of automated software tools for wound care clinics. And the software will be available on a mobile app, which doctors and nurses can use to personalise care pathways for people with chronic lower leg wounds. Presumably it's using a deep learning model based on existing wound care datasets, and that will be able to offer more personalised treatment options. And then the second project is developing an AI guided tool to help doctors and nurses interpret a patient's troponin levels to diagnose heart attacks more accurately. So it's great to see a few nursing related AI projects happening in the NHS. Of course, there's lots happening on the ground at Guy's and St Thomas's NHS Foundation Trust as well. The new 10 million medical imaging centre at St Thomas's Hospital incorporates the latest AI technology for more advanced medical imaging to improve the diagnosis of a range of cancers and other diseases. GSTT also pioneered the fellowship programme in clinical AI, which is great, but I couldn't find any nurses who had gotten this fellowship yet. It's mainly medics with 1 or 2 physios and pharmacists, but the next round of applications is currently open, so hopefully future cohorts might include some nurses as well. And I think part of the reason funding hasn't come nurses' way in terms of AI is that many nurses lack knowledge and skills in artificial intelligence as they've never had any formal education or training on it. And they also don't have the time to develop their expertise further because they have so many clinical and other commitments. There have been various reports over the last few years highlighting the need to educate the NHS workforce about all things digital, including AI. So digital literacy and AI literacy across all the professions is important, as is preparing nurses to work in digitally enabled practice environments and to deliver digitally enabled nurse-led research. That's one of the priorities in the current research strategy for nursing from the CNO. And since those reports, NHS England have invested in upskilling the workforce on AI. The NHS Digital Academy has been running for a good few years now, and that has several training programs, including a digital health leadership program for managers and leaders and the Topple Digital Fellowship. As far as I know, only a handful of nurses have completed those programs, and I could only find one Topple fellow that was a nurse doing something in AI, a lady called Lorna Curry who works in Northampton General Hospital, and she's using natural language processing and speech recognition technologies to improve communication with patients in emergency departments. So we really don't have a lot of nurses in the UK contributing to AI yet, which I think is a missed opportunity. There's also plenty of research that shows nurses lack knowledge and skills in AI, and they don't get many opportunities to take part in or lead clinical research on AI. These are some of my own publications, but there's lots more research saying the same thing. There's our systematic review on AI in nursing and midwifery from 2023. That was in the Journal of Clinical Nursing, and a more recent review of digital health research conducted by nurses in England. I did this review with Natasha Phillips, who was the CNIO of NHS England at the time, and it was done to support the Phillips Eyes review, which looked at building informatics capacity in the nursing and midwifery professions. And both those reviews found the same thing, that there's very little AI research being done by nurses in the UK, which I think is a real shame, because I know that nurses have great ideas about how to create new AI tools or introduce existing AI-based technologies into their own work, whether it's delivering frontline care, being a nurse manager or a director of nursing services. You can apply AI anywhere you have digital data, which means we can use it everywhere. We just need to give nurses a hand to get started on their AI journey. So this is really where the idea for a clinical research network on artificial intelligence came from. We got funding from the Burdett Trust for Nursing earlier this year to set up the AI Nurses Network, which is great. We have a dedicated website where you can sign up for our monthly newsletter, which will be starting in January 2025, and that'll keep you up to date with things that are happening in AI and healthcare and any opportunities in the network itself. As well as the website and the newsletter, we will also be offering 3 things as part of the network. So the first is a suite of free educational resources on AI and data science to help nurses learn the fundamentals of artificial intelligence. So the training covers topics like machine learning, natural language processing and more, to give nurses the knowledge and skills that they need to understand and apply AI in clinical research so they can improve professional practice and patient care. There's an existing online training programme at King's called Innovation Scholars, which was funded by UKRI a few years ago, and that's run by Professor Rebecca Oakey and her team. She's an epigeneticist by trade, and Rebecca is very kindly working with us so that we can promote this training to nurses. It covers all the essential AI and data science topics that you'll need, and it was specifically designed for healthcare professionals in the NHS. So you can create an account on the e-learning platform for free. It's very quick and easy to set up, and then you can enroll in any of the AI and data science courses that you like. So this is a quick overview of the training that's provided, and they'll be adding more courses soon, like one on NLP and AI ethics. So you can pick and choose from a whole range of things like how to code in Python, learning about predictive modeling, machine learning, etc. The courses are a series of self-directed videos that you can work through at your own pace, and there are some practical online toolkits as well to help you learn the more technical topics. So it's a great resource to have and will be really useful for nurses to get to grips with the fundamentals of AI. The training has also been mapped to NHS England's new AI and digital healthcare technologies capability framework to make sure you can achieve a range of digital and AI competencies that are relevant for working in the NHS. And each course tells you exactly what competencies it's mapped to, so that's really helpful as well. We also plan to run our own bespoke AI training as part of the AI Nurses Network, which will be specifically for nurses, and that will be in person and very hands-on next year to help nurses learn how to access and clean a digital dataset so it's ready for predictive modelling, how to choose appropriate algorithms to use, and how to run and validate an AI model. Some machine learning colleagues at King's are going to help me run those workshops next year, so keep an eye out for them on the website and the newsletter. We'll be advertising them as soon as they're organised. The second thing that the AI Nurses Network is doing is providing ACORN funding to support some pilot projects on AI in nursing, and that funding call will be open in a few weeks' time on Monday, 6th of January, with a closing date of the end of February. So that gives you roughly 8 weeks to apply. And we'd love to see as many applications from nurses as possible. If you have an idea for AI research in your area of clinical practice that you want to get off the ground, please do apply, and hopefully we can support as many nurse-led AI research projects as possible through that seed funding call. The application form will be available on the website from the 6th of January. It's not overly long or complicated, and it includes the standard questions you would expect around what's the existing evidence on the problem that you want to address so that your background is clear and the gap is clear. What is your research question and study design, the methods that you're going to use to collect and or analyse data, and then the impact of your research along with a budget, timeline and a description of the team who's going to deliver the project. So it's very straightforward, and we will also have a guidance document available that will describe the types of clinical research on AI that we're looking for, the amount of funding available, the closing dates, assessment process, etc. And those will all be available from Monday, 6th of January. So if you're interested, please do apply. We also hope to run a webinar mid to late January to go through all the funding call with you and answer any questions that you have, and we'll record that if you can't make it, and make the live version and put an FAQ document on the website as well. And then the third thing we'll be offering is we'll be promoting networking and other events from existing AI groups in the UK, like the Alan Turing Institute and King's AI Institute, as well as running some of our own networking events to give nurses an opportunity to meet AI researchers and AI industry so they can get their ideas off the ground. So hopefully the AI Nurses Network will go well over the next 12 months, and we'll be able to get funding to keep it going and to scale up some of its activities. So we'd love for as many nurses as possible to join this clinical research network, and we hope that you get a lot of value from it. We're also very open to new ideas for the network and expanding and improving it in different ways. So feel free to reach out to us on LinkedIn or via email. We've already applied for some additional funding to run a hackathon next summer focusing on AI in nursing as another way to encourage nurses to get their ideas for AI off the ground. And we're hoping to record a podcast series as well with nurses all over the world who are doing research on AI. We're not on any other social media platforms at the moment other than LinkedIn, because we want to keep things as professional as possible. So you can follow the group on LinkedIn as well as sign up for our monthly newsletter. Before I finish, I want to say a big thank you to our funder, the Burdett Trust for Nursing, who's very kindly supporting the AI Nurses Network, as are our great team. So besides myself, there are several other colleagues from King's involved, including Rebecca, who I mentioned, Dr. Karina Crossan, Professor Jackie Sturt, and our research assistant Richard, who will be starting soon. We also have a wonderful PPI person, David Woodcock, and Dr. Susanna Bench, who's our clinical liaison at Guy's and St Thomas's NHS Foundation Trust. As well as that, we have a nursing colleague, Professor Emma Stanmore at the University of Manchester, who's also involved to help reach nurses in the northern and central parts of England. And we're putting an advisory board together, which should be in place for early in the new year. So a big thank you to everyone on the team. Lastly, I want to share this upcoming conference with you in case you really want to learn more about artificial intelligence and keep up with all the major trends. The annual AI in Medicine conference is on in Italy next year, and this has been going for 20 plus years. There are a small group of nurses, including myself and some colleagues from around the world, that attend, and we have a nursing focused workshop at this conference every year. So it's a great place to meet like-minded AI nurses, and Northern Italy should be lovely in June. It's just outside Milan, so please do join us if you're free. So I know artificial intelligence might seem like the furthest thing from nursing, but it's not really. Historically, nurses have focused on hands-on care, and that will always be the core of what we do. But just like Florence, we need to use the data we collect on our patients to improve the care we deliver. And in the 21st century, the best way to do that is to collect data in a digital form and to analyse it using AI and other computational techniques to understand and improve our practice and patient care. So that's everything from me. I hope the AI Nurses Network has tweaked your interest, and we've a dedicated email address which is on the slide if you'd like to follow up with us on anything. We're very happy to collaborate with anyone and expand the network in as many ways that are useful to nurses. So please do reach out to us on LinkedIn or email if you're interested. Thank you.